Hey everyone, welcome back to this week's video. I'm Dr. Heather Hirsch. If you don't already know me, I am the clinical program director of the Menopause and Midlife Clinic at the Brigham and Women's Hospital in Boston, Massachusetts. I would love to see you as a patient. Currently, I can only do telemedicine in Massachusetts, New Hampshire, and Rhode Island. Hopefully, after times are a little different and we can travel, I would love to be able to see you in my office, and then if you do live farther away, we can do the rest of them via virtual telemedicine. It's just the first one that you need to be in the office for. A couple other places you guys know to find me: Instagram, I'm at hormone.health.doc, and Twitter, I'm at Heather Hirsch MD. So today I wanted to talk about why or why not to use menopausal hormone therapy. So we're going to talk about the whys and then also maybe the when. When should you use it? When is the right time, or how do you know when it is right for you? So that's what I want to dig into today. All right, let's get started with the very first reason of why to choose menopausal hormone therapy, and that is that you have terrible symptoms. Now, terrible symptoms are not the same for everyone. Certainly, the most common symptoms going to start with your hot flashes, and then that could be night sweats, frequent night awakenings, poor sleep pattern in general. It could also be trouble with mood, memory, cognition, and or you could also experience commonly vaginal atrophy. We now call this genital urinary syndrome of menopause, and click right here. I did a whole video on how to keep things normal down there after menopause, which is another good one to watch. Perhaps you're also noticing other things that hormone therapy is not necessarily FDA approved for, such as hair thinning or issues with metabolism or weight, joint aches and pains, and you want to consider hormone therapy for your symptoms. Now, you don't have to choose hormone therapy. There are certainly lifestyle things and non-hormonal things that you can start before choosing hormone therapy. Okay, so what are the lifestyle tips that you can start with? Well, things like the obvious, dressing in layers. So if you get hot, you can take off your sweater or sweatshirt, so dress in layers. Of course, keep your house really cold. In fact, if you can keep it at 65 degrees, or if your partner and children, if they're in the house, will let you keep it at 65 degrees, that is wonderful. Develop a really good sleep hygiene. Right here, I'm gonna link to a video on Why Can't I Sleep, which has some really great sleep hygiene tips in it. You can check that out as well. Continue to meditate, eat healthy, and exercise. Now, what has been shown in research to actually be helpful are things like cognitive behavioral therapy and hypnosis. Now, I have never actually sent anyone for hypnosis, and cognitive behavioral therapy is something that you do with a therapist. Is kind of hard to find because you need someone who's specializing in controlling those hot flashes or symptoms through CBT. So lifestyle changes, you probably heard of them all, and certainly implement them. I did a whole video on non-hormonal options, which you can click to right here as well. And a lot of those include low-dose antidepressants or other medications used off-label that can help blunt hot flashes. But why to use hormone therapy? Well, it is clearly the most efficacious. So there are certainly two main groups of people, and then of course there's always people in the middle. There's the people that want to go stepwise, and that is absolutely fine if that is you, starting with lifestyle and maybe going to non-hormonal or then going to hormone therapy. And there's some people that are like, give me what's going to be the most efficacious, and definitely hormone therapy is a great option. Certainly also, I know I'm linking a lot of other videos. My video here on the safety and efficacy of hormone therapy is also really important because this video is not going to address that, but those are really helpful to dispel myths and misconceptions about hormone therapy. You know, that's another big piece of starting hormone therapy. So really, reason number one is that your symptoms are just really bad and they're interfering with your quality of life. Now, reason number two is you want to be proactive about your health. Now, certainly this can mean a lot of things, and I want to take a big step back and actually really, for the record, hormone therapy, essentially estrogen, you need a progesterone if you have your uterus, but the good stuff all comes from estrogen. Hormone therapy has is not used for primary prevention of diseases such as cardiovascular disease, bone loss, osteopenia, and osteoporosis, and some other things, including decreasing diabetes risk. But studies really do show that they're helpful for those things. Now, again, I guess this makes it a little controversial, and it again depends which way you look at it. But certainly I have plenty of patients come to my office who say, I've watched your YouTube videos or other YouTube videos or read some books, and I have also learned that estrogen is really good for my heart and keeping me healthy and or looking young and beautiful for the rest of my life. But I want to do this safely with a doctor, and I want to make sure I'm using FDA approved options because I know they're the best studied and the safest. Big A plus. So again, it is not FDA approved for primary prevention, but again, we do see these in a lot of the research. Now, this is really huge news. About 2 weeks ago, or in early December, the American Heart Association, the AHA, released a new hot off the press scientific paper in which they really clearly stated that the menopause transition is related to cardiovascular diseases because estrogen is actually quite good for our heart. It's a vasodilator, opens those blood vessels around the heart. It does good things in our gut. For example, women who take hormone therapy have less diabetes. We don't know why that is, but it's a trend that we see. And they have come so far as to say that there are a lot of benefits for cardiovascular health in women, for women who start within 10 years of menopause, particularly and especially and definitely if you've had a premature menopause, which is menopause before age 40, that hormone therapy should be the gold standard because of the increased risk of heart disease. Now, this is huge because heart disease is the #1 cause of death in women in the United States. It is the leading cause of death even in women who have other diagnoses, such as strokes and breast cancer and diabetes. So heart disease is huge. And to have the AHA come out and say that the menopause transition is a risk factor, it is a time in which cardiovascular disease can change or decline for some people, and that estrogen therapy looks to be beneficial is really important. Now, they didn't say that we use this for primary prevention. They kind of stopped right there. But again, if the number that we're on here, number 2, you want to be proactive about your health, then yes, consider taking hormone therapy. Now, of course, you want this to be, for an FDA indication. So oftentimes I'll ask, have you had any hot flashes, or is there been any vaginal atrophy, or is there any osteopenia, a precursor to osteoporosis? Those can help me get you hormone replacement therapy or hormone therapy for reason number 2. You want to stay proactive about your health. All right, reason number 3, I actually just alluded to, is osteopenia. Yes, estrogen and menopausal hormone therapy is FDA approved for osteopenia. Now, osteopenia is the precursor to osteoporosis. Osteoporosis is the condition in which your bones become so brittle and weak that if I fell from a standing height or I fell off this chair I'm sitting in, I could break a hip or one of my spine bones. And so because estrogen is so preventative at declining bone densities, meaning that it can avoid going into the osteoporotic range, you can also use hormone therapy for osteopenia. Now, an important point here is that I certainly have had patients with osteoporosis ask me about estrogen therapy, and perhaps they also have an aversion to some of the other osteoporosis medications. And if you want a whole video on osteoporosis, because we really haven't done one here, let me know in the comments below. Drop me a little message on the osteoporosis, yes or no. But once you do get into osteoporosis range, estrogen therapy or menopausal hormone therapy is no longer seen as really a viable treatment option. Now, that doesn't mean it's not going to maybe help. You just might need more of a heavy hitter once you lose that much bone. So that is really the 3rd reason you might want to consider hormone therapy. And the 4th one is, well, I want to stay young and beautiful. All right, is estrogen the fountain of youth? Possibly. Now, this one also too is sort of controversial. Yes, estrogen is great for things like hair, skin, and nails. It can help with dry skin. It can help, possibly also as well with things like wrinkles and things like that. Again, not at all FDA approved for those types of uses. It doesn't mean those things aren't going to be positive side effects. If you are going to take hormone therapy, certainly you don't have to use hormone therapy to stay young and beautiful. Truly, it is a mindset. Of course, lifestyle things for this are significant. Make sure you're exercising. Make sure you're doing weight-bearing exercise and lifting weights to build muscle. Make sure you're avoiding big uses of alcohol and smoking. Those two things are going to really worsen the condition of skin, certainly worsen collagen, create wrinkles, bags under our eyes, certainly decrease our good sleep quality, even if we think we're getting good sleep. So healthy habits go so far in keeping us looking young and beautiful. Of course, there's numerous products on the market. You probably all have your favorites. Please let me know which ones you like. This certainly isn't a health and beauty channel. I do love the stuff from Pause While Aging. And also, if you are a beauty or skincare line for midlife women, feel free to contact me and let me know, because I'm always looking for products to recommend to my patients in this population in general, things that are really good for skin as we're aging, as the hormones are changing and we're going into our 50s, 60s, and 70s. Lots of lifestyle things that you can do. Of course, self-care and keeping up with the maintenance things that you like to do is going to keep you also feeling well. I have a whole video on hair thinning. Check it out right here, because a lot of people care a lot about their hair, and that is A-okay. You can care about your hair. Check that one out here. There's certainly lots of vitamins and supplements that you can also use that are really good for maintaining beauty. You can also check that here at the link up here. Now, again, if someone's going to use hormone therapy or wants to use hormone therapy for these reasons, I really want to max out what they're doing with their lifestyle, because it's not an FDA indication. I might ask if they have hot flashes or trouble sleeping or genital urinary syndrome of menopause, and oftentimes people do have some of these symptoms. And again, then if I can find a reason, it's better for me to give you an FDA approved replacement medication than for you to seek it out somewhere else and get something compounded if you are dead set on doing that, because that could be much more dangerous for you in the long term. So there's 4 big reasons on why you might want to take hormone therapy, or what else you could do if you don't want to use hormone therapy. Now, when to use hormone therapy, right? This is always the question, and I think when patients do start to think about this, it's really important that it's done on your own terms, and you have really, made a very good decision about this. There's a couple of things I'll say to my patients who may be on the fence. The first thing I'll say is, track and journal. And one thing to consider is, are you having more bad days than good days? More, days full of symptoms than days free of symptoms? Is this affecting your job, your relationships, your time with your children, your self-esteem, your ability to get to exercise? If it's really affecting those things, and you can really see that if you step back and journal and track for a while, then it certainly might be time. If they're still on the fence, the second thing I will say to people is, give it a 8-week trial and see. Now, when I see my patients and start them on a regimen, I usually have my patients do that for a good 8 to 12 weeks before I see them again and maybe adjust their medications or help them through things. But 8 weeks overall is a pretty short snippet of your life, and give it a trial. There's probably not going to be too many risks that come to you in an 8-week trial of a medication that overall is very safe and effective, and that will give you the biofeedback that you need. Certainly, then the majority of my patients, especially if they're suffering with their symptoms, do continue because they find it to be really efficacious, but not always. And so you could always just give it a trial run to see. You're not married to it, you're not stuck with it, and you could always change the route and the dose, and you know, how and when you take it. So there's so many different variables. So that's what I say to my patients on when they ask when is the right time to take it. I also did a great video on the right type of hormone therapy for you, and I'll link that here. Again, lots of links in this video, but a nice bridging video on when to take, why to take hormone therapy or not to take it, and when to take it. So thank you guys so much for tuning in to this week's video. I love all of your comments, your feedbacks, your suggestions. Remember, anytime you leave me a comment in the comment section below that is a personal medical question is really hard for me to answer, and definitely best for you to talk with your own doctor about. But I'm happy to answer general questions. If you guys want to see me in Boston, Massachusetts, the number to my office should always be down in the link below. But yes, you do need to be in Massachusetts or one of those New Hampshire, Rhode Island states so that I can see you. And hopefully, again, we'll be able to expand telemedicine because that would give me more wiggle room to do more consults and learn about each and every one of you individually that would like to see me. There is also a way you could do a second opinion with me, and that link is down below. Also, check out all the stuff in the description bar below. I have tons of things down there of my Amazon store, my course, all the things that I really recommend. Please feel free, browse. It's Christmas season, so send any ideas your friends and family's way. And thanks again. Please subscribe to the channel if you haven't already. And the reason is not just for me at all. It really helps YouTube tell women who are searching for menopause topics or questions to head over to this channel and get some really good evidence-based facts and education about all things menopause, perimenopause, and midlife. So thank you for giving this video a like, and thank you for subscribing. I love the community that we're building here, and I couldn't do it without all the support and encouraging words you guys give me after every video. So thanks so much. Please keep sending your suggestions for more videos, and I will see you again next week. Bye!